Good evening and welcome to this evening's COVID-19 vaccine Dispelling the Myths and Misinformation webinar. My name is Councillor Asha Craig. I'm the Deputy Mayor of Bristol and I'm also the Cabinet Member with responsibility for communities, equalities and even more importantly, public health. Tonight's event is hosted by Bristol's Race Equality COVID-19 Steering Group, of which I am the chair. We stood this group up following the reports on increased impact on people of the COVID virus on people from Black, Asian and minority ethnic communities. Having heard the questions and concerns around the vaccine from communities through the steering group, we've brought together a number of healthcare professionals to talk about the vaccine. We want to reassure you that your concerns are real and valid, and we take very seriously the questions that you submitted prior to this event. I have to say we've had hundreds of questions and we're going to do our very best. A lot of them have been grouped together, so Dr. Jo Brooks, who is my Vice Chair, she will take you through the process and explain how we're going to respond to your questions in the chat function. What you need to understand is that we are dealing with UK-based evidence in relation to the responses that we will be giving you this evening. What we want people to learn and to leave tonight's event knowing more about the vaccine, having your questions answered, and feeling much more confident to talk to your friends and family about the vaccine. With 2 COVID-19 vaccines approved and more trials taking place, many of us have so many questions. And I'm delighted that we are joined this evening by Dr. Lazarus, who is a consultant in infectious diseases, to discuss how vaccines work and help us to understand the information that is out there about the COVID-19 vaccine. So this is your chance this evening to ask questions about the COVID-19 vaccine. And I'm now going to pass on to my colleague, Dr. Jo Brooks, who will be chairing the rest of this evening's webinar. Thank you. Over to you, Jen.
Thank you, Councillor Craig. Thank you. And good evening, everyone. And like Asha, I'm very pleased to welcome you all to this event this evening. It's great to have you all. Now, just going to start with some housekeeping, everyone. We are recording this event and it will be made available for you after the event's finished. You will be emailed the link along with some other information about this event. Because we're recording, when you send questions to us, remember, don't include any personal information. Second thing to tell you, as Councillor Craig said, there are hundreds of questions, but we're going to do our very best to get through as many as we can this evening. We may not be able to answer your particular questions, but after the event, what we will be doing is sending you information so you know where to look for more answers. We have a question and answer facility, so please feel free to put your question and pose your question to us, but do listen as Dr. Lazarus presents, because it's likely that in her presentation, she will be answering many of your queries. I would like to now just take a few minutes to introduce you to our expert panel. Their bios are very long, but what I've done is just picked out a few points. I'd like to introduce you to Dr. Neil Kerfoot. He's a GP of 24 years at Kingswood Health Centre, who's leading on the vaccine rollout. That's it, Neil, big wave. Neil is leading across the whole of Bristol, North Somerset and South Gloucestershire. He has keenly followed the data, but he said that one of the best things he's seen is the look on the faces of the over 80s and their relieved expressions as they've rolled up their sleeves for the vaccine. Thank you, Neil. Our next panelist is Dr. Huzaifa Adamali. Dr. Adamali is a consultant respiratory physician in the North Bristol Trust and has lots of first-hand experience of treating really ill patients. And I'm sure that Dr. Adamali will share his experiences tonight. He also has a lot of experience of recruiting ill patients to trials so that we can find out the best way to treat COVID disease. Thank you, Dr. Adamali. I'd like to introduce you also, everyone, to Miss Julie Northcote, who is a consultant in public health. Hi, Julie. So Julie leads the 7-day public health duty desk team and responds to outbreaks, incidents, and queries. And they provide advice to public settings like schools, universities, and really support the most vulnerable settings. Thank you, Julie. Also with us tonight, everyone, is Mr. Mohammed El Sharif. Mr. El Sharif is a community development officer or manager. Nice to have you with us, Mohammed. He leads on the outbreak management work for the Neighbourhood and Community Service for Bristol City Council. And Mohammed's role is to develop and oversee the outbreak management efforts in North Central Bristol. Mohammed also has set up and oversees community champions who work with the Black, Asian and minority ethnic population. Great to have you with us tonight, Mohammed. Dr. Charlie Kenward is the clinical lead for research and improvement at Bristol, North Somerset and South Gloucestershire CCG, and is also a GP at Southmead and Henbury Family Practice. Dr. Kenward is supporting the COVID-19 mass vaccination campaign and is working to ensure that everyone has access and opportunity to receive the vaccine, with a focus on groups who are considered to be at above average risk, and to support the uptake. Thank you very much, Dr. Kenward. Good to have you. And Dr. Liz Murphy is a retired GP and member of the Patients Not Passports and MEDAC groups. Dr. Murphy was an inner city GP for over 30 years and has also worked at the Haven, which supports asylum seekers and refugees. Dr. Murphy's interest is in how migrants who face barriers to GP registration will access the COVID-19 vaccine. Great to have you this evening, Dr. Murphy. And so everyone, I'd like to introduce our speaker this evening, Dr. Rajeka Lazarus. Dr. Rajeka Lazarus is a consultant in infectious diseases at the Bristol Royal Infirmary. She trained to be a doctor in Cardiff, London, and Oxford, and has a PhD in vaccinology from Oxford University. She's the lead doctor for the COVID-19 vaccine trials in Bristol and the Southwest. And Rajeka also was born in Sri Lanka and has been in the UK since a young child, when her family were forced to take refuge from the Sri Lankan Civil War As well as being a doctor, Rajeka is a wife and a mother of 3. Rajeka, welcome this evening, and thank you very much for being our main speaker this evening.
Well, thank you. It's a pleasure. Thank you for that introduction. So I'll start. Can everyone hear me? A thumbs up will be good. Yeah, great. So this session is called Myth Busting. So really what I'm going to talk about is what are myths, and try and answer some of the questions that we really want to know about the COVID vaccine. So just bear with me, I'm going to share my screen. Okay, we're there. Okay, so what are myths? Myths are stories that we make up to explain things that we don't understand or have not received the right information about. Myths are made because we want and need to understand how and why things happen the way they do. We have a right to know how things work, especially those things that affect us so personally, and for those that we're expected to make a choice about. So it is natural for us to want to know as much as we need to know about the COVID-19 vaccines. So really important questions such as, how does a vaccine affect our fertility and our freedom? These are issues that are really close to our hearts and not things we can take for granted because of our history and of the inequalities that we still suffer from today. But I can tell you that the vaccines do not have an impact on fertility, and they certainly do not contain a chip that will track us. We also really need to know what the vaccine is made from. The vaccines do not contain animal products or cells from aborted fetuses. We need to know this because it's important to our faiths and our belief. For some people, what's in the vaccine is really important because there have been allergic reactions reported. And those allergic reactions are really related to very few ingredients that are actually contained in the vaccine. Now, this is not a list for anyone to learn, but it's just to show that actually most people with allergies, even with severe allergies to food products or things like nuts, can safely have the vaccine. But we do know that there'll be a small number of people who have severe allergic reactions to these ingredients that should not have this particular vaccine. So this is the Pfizer vaccine. And this also includes people who have severe allergic reactions to something, but they don't know what, or to lots of different drugs which may contain one of these ingredients. But this information can be found out. This is from the government website, and it will be available at the vaccination sites as well. So this is just an example, 2 examples of those really important questions that we want to know about. But it's not always easy to find the answers, right? Because sometimes the people who have the answers may not have considered the questions that are important to us. And when the information is out there, it may not be available in a way that it will reach us in a way that's familiar or easy to access. This means we may turn to sources that are not reliable and do not speak the truth, like on YouTube or WhatsApp. Sometimes we may be scared about asking the questions as we think it may cause trouble. Like, can your friends still have the vaccine if they don't have their papers? This vaccine is for everybody, papers or no papers. Sometimes newspapers write headlines which are designed to grab our attention and sell news, but they raise questions and do not provide the necessary answers. One thing the newspapers have really liked to talk about is how quickly the vaccine has been made, when usually it takes years and years and years. But don't make it clear why or how the vaccine has been got ready so quickly. So I'm going to explain some of the reasons that have meant that this vaccine has been developed so quickly, and talk about some of the questions that the processes pose. So the preparation for the vaccine started even before we knew this pandemic was happening. Vaccines have been developed for hundreds of years now, and over that time, the way we make vaccines has changed. We have new modern types of vaccines that are much easier to produce than previous vaccines. The current vaccines that we're using for COVID-19 actually use just a small piece of genetic information from the virus as opposed to the whole virus. And so how that works is this genetic material gets injected into the muscle, and it just stays locally in the muscle and does what it needs to do. And what that does is hopefully prepare us to be protected against COVID-19 in the future by training our bodies to be able to produce a response. But it's only there for a very short time before it's broken down. And when it's gone, it's completely gone. It doesn't stay in the body long term, and it's not passed on in fluids such as breast milk. So this vaccine is safe for those who are breastfeeding. So this is really great new technology. It's very similar that our lives have moved on, because now we can use our phones for more than just making phone calls, right? But it doesn't mean that this vaccine contains a chip. So it definitely doesn't contain the chip to track us, like our mobile phones perhaps. Okay. Since the Ebola outbreak in 2014, there has been a lot of money put into developing Okay, sorry, I cut out there. I'm back. I'm going to share my screen again. So since the Ebola outbreak in 2014, there has been a lot of money put into developing vaccines that will be ready for a future pandemic. And there's been a lot of thought into working out which infections are most likely to cause a pandemic. And we have had problems with coronaviruses such as SARS and MERS in the Middle East that have caused small outbreaks and even large outbreaks around in different parts of the world. So people were already getting prepared to make vaccines in case they were the agents that will cause the next pandemic. So by the time COVID-19 came along, there were already vaccines made against MERS and SARS that had been tested in animals and tested in humans that could be quickly adapted to be used against COVID-19 infection. So really that was the first stage, and all the initial tests that needed to be done before it gets into humans got underway very, very quickly indeed, and were all completed as they needed to be. The next stage is for the vaccines to be tested in humans, and for this there needs to be a lot of money, and it can take years usually to get a lot of money to do the studies. But the UK government agreed to fund the vaccine studies very early in the pandemic, which was really great. And then the testing itself needs to be done as part of a clinical trial. And again, ordinarily, it can take a long time to design a clinical trial, to get all the staff that you need and get it all set up and running. But because this was important, a lot of people, including myself, stopped everything else they were doing and just focused on getting the vaccine studies done. So there's me, and there's probably over 200 people in the Bristol vaccine research team who are involved in delivering the COVID vaccine studies. And I wish that I could say that we were working 100% of the time, because it felt more like we were working 200% of the time. We were working 7 days a week, starting early and finishing late. And that just wasn't just us. There were teams in Oxford and other parts of the country all working on getting these studies started. Of course, the most important people in any clinical trial, though, are not the people like us working on it. They are the volunteers. And in ordinary times, it can take a long time to get volunteers because you have to get word out about the vaccine, advertised, get people to know about it, which can be challenging. People are busy. They don't have time to come and take part in the studies. But this time it was different. Everyone had heard of COVID-19. People knew that a vaccine was needed. People wanted to help. People wanted to be involved in the vaccine studies. And importantly, because we're in lockdown, people had time. We had no problem with people volunteering to come on a sunny bank holiday Friday, as it was, to help out in the study. In terms of volunteers, it's true that most people who volunteered in the study were of white ethnic background. Worldwide, there were people from different ethnic groups. However, we did really want the study volunteers to be made up much more of a proportional, diverse range of people, like the people who would need to be vaccinated. And it's not too late because we do have other studies coming. But the studies did include older adults. So we recruited adults who were 70 and older, so in their 80s, in their 90s. And we did enroll people who have medical problems, such as diabetes, such as heart disease, such as lung problems as well. We haven't done studies yet on women who are pregnant, so we don't have all the information we need to routinely recommend this vaccine in pregnancy. However, there's no reason to think that this vaccine won't be safe in pregnancy, and those studies are planned. Other vaccines are given very safely in pregnancy, such as influenza and pertussis vaccine. So as it is, if a woman is pregnant and they are at risk of severe COVID-19 infection, then they should be considered to have this vaccine. Okay, so as part of the study, we monitored people very carefully to make sure that the vaccine was safe. After the volunteers were vaccinated, there were several appointments, and they could always get in touch with us if they had any symptoms and report any medical problems, so any issues could be spotted. Around the world now, there are over 23,000 people who have volunteered to take part in the Oxford vaccine study, and some of them have been in that study since April 2020. So we have a lot of information to judge that the vaccine is safe. And we also have a good idea of the types of side effects that people do get from vaccines. So side effects are things that happen after any medication or vaccine, and they are expected, and they are short term and don't cause any long lasting problems. And so this information can be found on the government websites. It just tells you the kind of things that you can expect. I mean, some people don't feel anything at all, but a lot of people will have a sore arm and feel pain around the site of the injection. A lot of people will feel tired and have a headache afterwards. People might have joint pains and muscle aches, and a smaller number of people might feel quite feverish and actually have quite a high fever and chills. But we know that taking paracetamol after the vaccination for about 24 hours helps reduce all these side effects, and they don't last more than 1, 2, or even 3 days. What's really important to remember is that some people might feel quite bad with these side effects, but the COVID-19 vaccines have not killed anybody. And that's not what we can say about COVID-19, the disease. So in the UK so far, there have been 100,000 deaths because of COVID-19 infection. And we know that those who are more likely to die are the elderly, people with medical problems, and people from our communities. And this is a graph that is kind of taking age aside, that shows that if you are a man of Black African origin, then you are 2.5 times more likely to die from COVID than your white counterpart. So this is serious, and this is very real. So as well as ensuring that the vaccine is safe, we also wanted to show whether the vaccine stopped COVID-19 infection. And to do this, we asked volunteers to come in if they had any symptoms of infection. So we started the study about April, and we carried on until June. And we will be seeing people throughout the summer during the lockdown with some symptoms, and none of them had COVID. But something changed in early September. Suddenly, we were seeing more and more people who were reporting symptoms, and then we started to get our first positive cases amongst our participants. And by that time, the Oxford study was happening in 18 sites around the country. So other parts in the country that had much higher infection rates than Bristol did at that time. And what's more, not only was the study done in the UK, it was also done in Brazil and South Africa, where there were extremely high rates of infection. But what this meant was that we were able to work out whether the people who got vaccinated with the COVID-19 vaccine were less likely to get severe disease than the people who got the control vaccine. So by the end of November, we had the information to show that the vaccine was safe and that it worked. But the final decision about whether the vaccine works and whether it's safe comes from the independent judgment of the government agency, who are the MHRA. And these are the agencies that approve all drugs and vaccines that need to be used in the UK. And usually this agency themselves can take months and months and months to approve something. But again, this time it was different. The MHRA had the information from the vaccine study as it progressed. So when the time came for approval, they didn't have to start again at the beginning. They already had some of that information. And again, like everyone else working on the vaccine study, working on the NHS, they weren't working normal hours. They put a lot of effort into making sure that they could review the data carefully and thoroughly, make the right decision. And what they found was that the vaccines worked and the vaccines are safe. So after gathering all this information and having checked over and over again, it was a very happy day when it was announced that the vaccine worked and it was safe. Now the vaccine has been given to thousands of people around the country, and I hope soon it will be given to millions of people around the world. But our work with the study is not finished. We're still following up our volunteers closely across the country and in Bristol. And the main reason we are following people up is to see how long the protection lasts for. This information will inform us whether people will need to have a further booster at a year or at a different frequency. Well, the follow-up also gives us further reassurance about the safety of the vaccine. And it has to be said that vaccines in general have a very good long-term safety profile. And unfortunately, that's a lot more than I can say for COVID-19 infection. Of course, the questions do not end there. And I know many of you have been wondering about the changes that have been made in the dosing. Initially, we were told that we'd be getting a vaccine 2 doses 3 weeks apart. And now it's been changed, so you'll get a vaccine and then maybe the next one 10, 12 weeks later. So the reason for doing this is really important. It's because a single dose provides good enough protection to protect against disease in the first instance. And that what we need to do is vaccinate as many people as possible, as quickly as possible, so we can bring down the rates of coronavirus infection. And if we bring down rates of infection, then the risk of infection to all of us is so much lower, we can afford to wait for that second dose. There are also a lot of questions about mutations. The chances of mutations are higher when the rates of infection in the world are high and passing from person to person. So reducing the rates of infection overall should also reduce the chances of new mutations. So having the vaccine will reduce the number of people with COVID and reduce the opportunity for mutations. Careful monitoring of mutations is key and will allow us to decide how well the vaccines are working and whether the vaccines need to be modified. So I'm going to finish there, but I just really want to kind of leave with a message that I think it's really important that you ask your questions, get informed, get vaccinated, because you're not only protecting yourself, but also your families and our communities. And why do we want to do this? I hear a lot of people say we want to get life back to normal, but I think life as normal was not necessarily a fair and just normal. So let's get ourselves into a position where we can create a new, fairer, better normal for all of us. Thank you.
Thank you. Thank you very much, Dr. Lazarus. That was really informative. So what I heard from that was that the vaccine has not killed anyone, and yet 100,000 people in the UK have died from COVID so far. Dr. Adamali, my first question is to you. We've had many questions about COVID disease itself. Many people think that COVID-19 doesn't exist, or somehow it was engineered in China or the US, and that the numbers are made up. Will you respond to that for me?
Can you see me, Jo?
Yes, I can.
Oh, sorry. I'm a little bit awkward with technology. I'm sorry. So I can absolutely empathize with the statement that COVID doesn't exist. In the heart of hearts, I wish that this dreaded disease did not exist. I wish these 12 months just could evaporate. However, I think the facts speak for themselves. Many have been infected, millions of people have been infected, and millions have died. As of day before yesterday, I was looking at the Johns Hopkins site, and over 97 million people worldwide have been infected with COVID-19. And there have been over 2 million deaths already. And in the UK, we have had 100,000 deaths. And working firsthand within the hospital system, I see this, and it's frightening, and it's worrying. These individuals are your family members, your communities, your neighbors. And yes, we have really good evidence clinically, radiologically, blood-borne tests to absolutely confirm that they have COVID-19. I think COVID-19 deaths are more likely to be underreported than exaggerated. And majority of COVID deaths have had positive swabs. A minority are recorded as COVID without a swab, but as clinicians, we have compelling evidence from a patient's symptoms, blood tests, and radiology that it's COVID. So it's really important that as a person, clinician, father, neighbor, community member, and a citizen of UK and the world, that I refute the statement and invest time to provide individuals with reliable information. It's so important that we check and recheck the source of the information that we are reading and refute the misinformation and prevent its transmission. Like the virus, wrong information can have hazardous consequences. So it's really, really important that we weigh all that is provided us today and make the right choices for us.
Thank you very much, Dr. Adamali. Thank you. And back to Dr. Lazarus, many people have asked, so obviously there are many participants tonight are from a Black and minority ethnic background. And with respect to the trials you just spoke about, Dr. Lazarus, how many Black people were there in those trials, or people from minority ethnic backgrounds?
And so I showed some of the numbers, and they were the majority of people were from a white ethnic group, but certainly kind of in the Pfizer trial in the US, there was quite a large Hispanic Latino group people, and about 10% of people who were Black in that study, and similar numbers in the UK with about 2 or 3% from the Asian communities.
Thank you very much. And is there any doubt or any reason to think that the vaccine might be more efficient, more safe in one group, one ethnic group than another?
From the data that we have, it looks like the vaccine works and is safe in everyone who's been tested in the different groups, and also the different age groups. Sometimes as we get older, our immune responses is not as strong as when we are younger, but actually from the Oxford study, the immune responses were very similar between the two age groups, which is very reassuring.
Yes, very reassuring. Thanks very much. There were many questions, everyone, about people with pre-existing health conditions and particularly autoimmune illnesses. So I want to go to the GPs now. Let's start with Dr. Kerfoot. Dr. Kerfoot, what's your advice to people that have pre-existing illnesses?
I think pre-existing illnesses unfortunately make you slightly more likely to become more unwell than perhaps someone who's, an age-related person who doesn't have your autoimmune condition. The advice is that we should be offering vaccination to everyone, and certainly people who have autoimmune conditions should be coming forward and getting the vaccine when they're called. Indeed, from an autoimmune condition point of view, you will be, depending on what drugs you take, you may well be classed as clinically extremely vulnerable, and therefore you are currently just about to become the cohort we're going to be inviting. So if you're unsure as to whether you're clinically extremely vulnerable, then you should be talking to your specialist, or you should have had a letter from the government during this COVID nightmare we sit ourselves in, to allow you to go forward, and you will be getting a phone call or a text from your practice, or you might get your letter from the government saying with details of how you can book into mass vaccination sites or local chemists, which is what your letter gives you access to. Or you can choose, if you want to stay local, to wait for your GP practice that should be 1 or 2 weeks behind that letter contacting you. But I would encourage everyone to get the vaccine, whether you have an autoimmune condition or not, but especially if you have an immune condition, as it does make you, unfortunately, more likely to become unwell should you contract this illness.
Thank you, Dr. Kerfoot. And another big group, and Dr. Lazarus mentioned them, of course, is pregnant ladies or people wanting to become pregnant. What's your advice to them with respect to uptake of the vaccine?
I think, as our speakers mentioned, normally during vaccine trials, the research to look at the effects of pregnancy will be an arm of a trial which would take place. That's one of the reasons why trials sometimes take a long time, because they, trying to get the funding to do each arm of the trial takes a long time. But as governments have put in quite a lot of money to actually allow us to progress this trial, we've moved forward. I think the interesting thing is that a piece of genetic material from the virus, which is inactivated, goes into a muscle in your arm and stimulates your immune system to be curious around the little protein that sits on the outer coating of the virus, so that actually it will develop an immunity to that shape. And should it then come across that shape in the next few months, it will already be in your system and be able to kind of pounce on the virus before it actually gets hold, rather than it coming into your system, your immune system battling to try to get an immunity. And by the time it's developed that over 4 or 5 or 6 days, unfortunately, the virus has got hold. So theoretically, it goes into your arm, it lasts for 2 or 3 days, and then your immune system is primed. And so in my head as a GP, there's no reason why that should harm a pregnancy. There's no reason why that should stop you becoming pregnant in the future. But the caution we're giving is, as this is new, if you have a choice, then actually we would suggest that actually you may choose not to become pregnant in the next 2 months. But I think, personally, if my wife had this and she were to become pregnant, I wouldn't be worried about that myself, because I can't see a reason why that would harm a pregnancy. And I think if she was pregnant and she was, a doctor seeing patients with COVID, working in respiratory, working in the hospital, or she was a nurse, or she was a taxi driver, or she was a bus driver who may well have exposure to things, then I would be really thinking about, actually, should you be getting this vaccine? Because actually that will hopefully protect you, reduce the severity of any illness you get. And we know that if you become very severely unwell when you're pregnant with a sepsis, that unfortunately can threaten your pregnancy. So you've got to weigh up the risks against the benefits. And I think it depends really where you sit in community, what job you have, but you need to talk to people about that and actually ask questions rather than just say, I'm just not having it, would be my advice.
Thank you. So I hear you, Dr. Kerfoot. So weighing up risks and benefits and asking questions, which of course people are doing this evening. Dr. Lazarus, just coming back to something that you talked about earlier. So once people have been vaccinated, can they still transmit the virus?
So it sounds like maybe there's 2 questions. So if you get the vaccine, then you don't become infected. So the vaccine doesn't give you the virus to transmit. Is that right? Yeah. Is that the question?
Yeah. And so,
yeah. Okay, so yeah.
Go ahead.
Yeah. So I mean, there are some vaccine types that are used, and those are called live vaccines, where the whole virus is used, but it's changed so it doesn't cause severe infection, but it still contains a live virus. Sometimes people can shed that virus, but these vaccines are very different. They do not contain any live virus, so you cannot get COVID from the vaccines, and you cannot transmit COVID either.
Thank you very much. We're moving on now, everyone, to think about the mass vaccination programme and how the vaccine's being rolled out across Bristol. Dr. Kenwood, are you able to tell us something about that?
Yeah, thanks, Jo. So the first vaccine to be approved for us was the Pfizer vaccine, which is the one that has to be stored at the really super cold temperatures, about -70, -80 degrees Celsius. And because of that need for it to be kept in that really, really cold storage, we had to deliver the vaccine from a number of sites. We started with about 18 sites around the area, so in Bristol, and then going down into North Somerset and up into South Gloucestershire. And of course, we started with the government advised groups. So that was initially people in care homes and their carers, and they moved on to the over 80s and frontline healthcare workers. So that was all done by invitation to appointment. Now that we have the Oxford vaccine, that one can be kept in a normal fridge and is much easier to transport. So that means that's starting to arrive in GP surgeries. So my GP surgery in Southmead started vaccinating people with that last week. And so that means, although you still have to come in and wait for 15 minutes, and we have to collect a bit more information than we usually would for a vaccine because it's a new one, it's a little more like having the flu vaccine. It should feel a bit more normal for everybody. And then, of course, we have the Max Vaccination Centre opening in Ashton Gate. Well, it is open, and that's taking people from all over the city and healthcare workers.
Thanks, Charlie. And have there been any problems with vaccine supply, delivery?
Shall I answer that one, Charlie?
Okay, go ahead. Yeah, I was about to, but you go ahead.
I think the vaccine, the rollout took part in phases, and in my practice in Kingswood, in East Bristol, was in phase 1. It was one of 4 practices in phase 1, and then there was 5 practices in phase 2. And the last phase was fish ponds were involved in that last phase, which was phase 6. And therefore, the vaccine arrived in phases over the space of around about 3.5 to 4 weeks. So we first vaccinated people on the 15th of December, and Katrina Booten and her team at Lodgeside Surgery started vaccinating a week last Friday, and they were the last cohort. So it was phased in at the time. This is similarly to the Mass Vaccination Centre has phased its approach. It started off with 1 pod delivering vaccines. It's gone to 3 pods this week, so it's able to deliver over 1,000 vaccines a day at its full capacity, and it's hopefully that will go into 4 pods over the next few weeks. So the Mass Vaccination Centre is going to help us, but actually general practice and the general practice sites, the 18 general practice sites that are main vaccination centres, and as Charlie stated, now we've got AstraZeneca vaccine and we can move that to our local practices. Hopefully that will then be coming to your own general practice, and we would hope, our wish is that every general practice will have stocks of the AstraZeneca vaccine so that they can vaccinate their population, so you can go and see your doctors and your nursing team that you know and you trust and you see for your flu jab every year, or you see for your contraceptive services, or you see when you're pregnant, or you see when you have a health problem. We'd really like those people to be vaccinating you, because we know that you trust your doctors predominantly, and actually and your nurses, and we hope that they're to normalise this and to actually make this local to you will enable you to access the vaccine as and when it's your turn. Talked a little bit about cohorts, and those cohorts have been developed by the JCVI. Starting off, we know that age and living in age is the main risk factor for COVID-19, severe illness and death, and therefore they've decided to vaccinate down the cohorts. But actually in cohort 4, which we're just approaching, the extremely clinically vulnerable will be vaccinated, and in cohort 6, which will hopefully be in early March through March, we'll get to cohort 6, then the clinically vulnerable. So those with underlying health conditions not severe enough to be labelled extremely vulnerable will be brought forward, even if you're in your 20s, into an earlier vaccine for you.
Thank you, Dr. Kerfoot. You mentioned JCVI. What's that?
I knew you were. Can I ask Dr. Lazarus? I think it's the Joint Committee for Vaccine and Immunisation, I think.
Yeah, that's right. That's right.
Thank you. Thank you.
That's a committee made up of different vaccine experts who review the information there is about vaccine after the MHRA, and then decide who should get it and how it should be used within the current vaccine schedule.
Thank you very much. And staying with the GPs, there's more and more information coming out about the Pfizer vaccine and AstraZeneca. Dr. Lazarus showed us earlier about the different side effect profiles. What if I decide that I want one and not the other? Can I choose?
At the moment, there are only a few reasons why medically you might need one or the other. So if you've had a severe allergic reaction to a vaccine before, it's worth discussing that with your GP or the person vaccinating you, because it may be that the Oxford AstraZeneca vaccine is preferable. Likewise, and coming back to the autoimmune conditions, if you are taking what's called a biological therapy, and if you're on one of those, you'll know about it. It's something you have to go, you have to inject or have infused through a cannula. Then again, I think the advice is to not have the Pfizer one. But at the moment, there's as far as I'm aware, and Neil hopefully confirm this, there isn't a kind of preference choice over which one to have. At the moment, people are being invited for an appointment, and it'll be the vaccine that we currently have available. And our advice is that you should take the vaccine that's on offer to you at that time, particularly because you want to get vaccinated as quickly as possible. They're considered scientifically as effective as each other, because we've only got limited trials on them. We haven't seen real world data yet for years to compare them. So my advice to everybody would be, unless there's a specific medical reason, take the first vaccine on offer.
Thank you very much, Dr. Kenwood. And obviously there's lots of things to think about, and it takes time to decide what you want to do. So say the invitation comes and I'm not ready to go for my vaccine yet. can I change my mind later on?
Yes, I think you can. I think we would encourage you to not do that, because we'd actually like to vaccinate people as we go down the cohort, but no one will be forgotten. We've spent the last week trying to contact people in the over 80s. We've probably got less than 20 of our over 80 population left to vaccinate. And these are people who aren't answering the phone, or we don't have a current phone number. So we're currently writing to them and actually saying, could you please get in touch with us, because we've got a vaccine to offer you. So if you're out of the country, if you're in hospital, if you're away shielding with your family and you can't get a vaccine locally to where you are, then actually no one will be forgotten. We will have lists. That's the one lovely thing about general practice. I know my lists, and we will continue to contact you until you say, I do not want the vaccine. So the only reason you'd come off the list is if you say, I do not want the vaccine, please don't contact me again. And what we would say at that point would be, I'm really sorry that you feel like that. We completely respect your decision. If you change your mind, then absolutely please contact us, and you will be able to have the vaccine when you choose that you want it. And if obviously you've been in cohort 3 and we're now down in cohort 7 and you contact us, then you'd be right at the top of our list the next time we had some vaccine. I think, going back to Charlie's point, I don't think there's a choice, but I think if somebody said to me, I really genuinely don't want the Pfizer vaccine, I would like the AstraZeneca vaccine, and I will have the AstraZeneca vaccine, then I'm so passionate about trying to get everyone to have it that I think I would try my best to allow to put your name on a list, so the next time we get that particular type of vaccine, we'd invite you. It may delay your vaccination, and it's important, I think, to try to get people vaccinated as quickly as possible. But actually, if you're absolutely adamant you only want one, then I think we have to respect that and actually consider that. And it may be possible. There's certainly no rule to say you can't ask for that. Whether we'll be able to oblige will depend on vaccine supply and what's coming to us over the next few weeks. Sometimes we get Pfizer, sometimes we get AstraZeneca. We don't currently know what we're going to get, we're told, and we've got about a week or 10 days to then book our clinics.
Thank you, Dr. Kerfoot. Mohammed, I'm coming to you now. Certain communities think that we've been used as guinea pigs, and so I'm not keen to take this vaccine, which is thought to be new. What do you say to that, Mohammed?
I think it's really, there is a lot of historical issues around people really trusting in institutions and organizations, and we acknowledge that, and we know it's really challenging. I think what I say is, we got trusted scientists. Dr. Lizzaro just talked about, the trial and the people from a different background being involved in it. And I think also we have a different society now. People from a different background, different, I think, faith. They are part of the scientific populations and experts. So we really need to move on trusting. And I think this is, for me, it's moving the whole into one conversation. There is no us and them on this. We're one community. We all face the impact of COVID-19. And I think as all the speakers said, we're talking about 100,000 people died. This is in the UK. We know millions. Each person of us knows someone who died, someone who really impacted by the COVID-19. So I think it's time for us to move on and trust our scientists. They are our scientists. They belong to all of us. Dr. Huzaifa, all these people are really trusted medical professionals working in our institution. The institutions has changed as well. We've got people who are from the communities, people passionate about the community, and people care about the community. Really, we need to trust them. We need to really and I think, there is no time for us to be hesitant on this. This is life and death. And I think really, we need really to trust our scientists on this.
So thank you, Mohammed. This is life and death. There is no us and them. From the vaccine point of view, is there anything in there that means that Muslims or other people won't be able to take the vaccine? So has it got gelatin or anything in there?
No, I think, as I said, we got really a very trusted, medical professionals from the Islamic background. You know, we have the guidance from the British Muslim Medical Associations really make it very clear there is no animal products on the vaccine. And I think this is really, even in our, you know, faith and values, God asked us to trust scientists. You know, Muslim, you know, scientists are really backing up this. All the Muslim scholars are backing this up. We saw in the video, Imam from Southmead taking the vaccine. So it's really show that it is halal and it is and it's safe life. That's the key thing. It's halal and it's safe life.
Thank you, Mohammed. You make a really important point about the importance of trust. Just going back to the GPs, Dr. Kerfoot, Dr. Kenwood, there's been historically huge mistrust about the big pharma companies, that they're going to make a lot of money about on vaccines. They're just trying to make money out of us. And that vaccines companies have immunity from any future challenge. What are your thoughts about that?
Thanks, Joe. That's a really interesting. Question. I think so difficult, isn't it? You know, a company has to make this vaccine, and this vaccine, you know, there's a cost associated with making this. I think the Dr. Lazarus might correct me, but I think the Oxford and AstraZeneca vaccine are approaching a non-profit approach to the vaccine. I think the AstraZeneca vaccine costs around about £3 a vaccine. I think the Pfizer vaccine costs around about £15 a vaccine. I think my answer to that really is that, you know, what we want is to stimulate your immune system to recognize COVID before it gets hold, and the mRNA in the vaccine will allow your cells and your immune system to generate that. The big pharma will supply that to your muscle for 2 or 3 days, and once the immune response has been stimulated, the mRNA disappears, but the immune response remains and is yours. It's not big pharma's, but big pharma has helped. So I think let's allow them to make some profit if that's what they need to do. Let's hope they have a social conscience and try to plow that back and make the vaccine available at much cheaper to other areas of the world where they perhaps are not in a position to pay the money that we can pay. Let's hope, but we're not in control of that. What we are in control of is coming along to a vaccine centre, you know, accepting that medical evidence suggests this is a good idea and getting the vaccine.
And I just wanted to add to that as well, really, to say that, to say that you're right, that there is money being made. I mean, it has taken a lot of money to develop these vaccines, and a lot of that money has come from public funds already, from government grants that go to universities, so not from those commercial companies, but yet that money does in some ways ultimately end up being used for profit. But I mean, does it have to be that way? Maybe this highlights this issue, and maybe this is something that we can look at in the future. There are other models proposed for things like antibiotics, for example, where we need them and there's not money to be made. So you're right, that is how it is now, but maybe it doesn't always have to be.
If I could just add one final thing on that, they're not immune. So when when pharmaceutical companies make big mistakes, they face big consequences. They face £1 billion fine. You know, $6 billion was a fine levied out a few years ago. So, you know, regulators, governments, courts all hold them to account.
Dr. Kenwood, that's a really important point. Thank you very much for bringing that up. And back to you, Dr. Lazarus. It's brilliant that all this money was thrown at the research trial, so everything could be done so quickly. But what about the long-term effects?
So vaccines overall have a very good long-term safety profile. Vaccines have been used for decades and decades and decades, and they've saved countless numbers of lives. So, and already we have information from people vaccinated since last April, since last, May, June. So that is coming close to a year now. And follow-up continues as well. And again, we need to balance it against what we know about COVID. And we certainly know that long COVID is a significant problem, meaning people don't become severely unwell, and having the vaccine stops COVID and potentially long COVID.
So the truth is, we don't know if they're going to be in effects in 5 years' time.
We're not anticipating any problems with the vaccine in 5 years' time, based on experience with the vaccines that have been used now for a long time.
I think what we can safely say, Joe, is that actually in 5 years' time, there'll be plenty of people who have respiratory fibrosis and are short of breath walking up the stairs who shouldn't be because they've contracted COVID. And certainly in my general practice, we are seeing patients who are previously fit and healthy in their 30s and 40s, who are now really quite severely disabled by COVID infection, by having had COVID. And that some of these are not being people who've been in hospital or have been on ventilators. So
Wow.
obviously, you know, being having high pressure ventilation to try to keep yourself alive, to try to get the oxygen into the system when you're severely unwell, will have an effect on your lung function. But we're seeing people who've not particularly been that unwell, but have had a chronic cough, who are now struggling, and they walk from the car park to my surgery and they're out of breath than they weren't before. So I think the long-term effects, that's what scares me. I'm a 54-year-old fit guy, I do triathlon. I genuinely am frightened of not being able to do that, because if I catch COVID and I get respiratory fibrosis, then that's it. I won't be able to do that. And you know, one of my colleagues posted a picture of her finishing a bike session and saying, didn't I do well? And one of our GB team members actually posted a picture of herself on oxygen in hospital saying, it's affected me. I'm as fit as I can be. I'm in my 40s. I represent Great Britain at triathlon. I'm now disabled by COVID, and I've been here for the last 3 weeks, and they're not able to wean my oxygen. And that was really frightening for me.
Thank you for that, Dr. Kerfoot. Dr. Adamali, do you want to say anything about that? So the respiratory effects of COVID, short and long term.
So having worked with lung fibrosis patients for many years, I can understand the fear of developing fibrosis. It has to be pointed out that the majority of patients who develop COVID-19 develop a special type of scarring. And the good news is that the majority of patients, the scarring tends to melt away beautifully. And the trials that we have done through the recovery study using steroid called dexamethasone has really proved to be of benefit. We have done some follow-up studies, and they have borne out that the patients who receive treatment appropriately within a hospital setting, majority of them are left with good, healthy lungs, and the fibrosis or the scarring melts away. The sequelae of long COVID are quite significant. And the major symptom that people complain of is fatigue. And that takes a long time to resolve. So the good news is we haven't seen established fibrosis in the majority of our patients. With convalescence, rehabilitation, people do recover from this long COVID. However, it's important to seek help, and that goes through your GP by contacting NHS 111, ensuring that you are slotted within a hospital setting if you really need treatment, getting the appropriate treatment, and post-discharge, having a follow-up plan for your rehabilitation. And that's where general practice can help.
So Dr. Adamali, I wonder if we're talking about two different populations. So you're saying that the people that you see, they get treatment as an inpatient and they seem to do quite well. Dr. Kerfert is talking about a lot of his patients who have experienced a complete change in lifestyle.
I can completely see that. The majority of patients that are severely ill and present to our hospital setting, they may get on oxygen treatment, they may get on a ventilator, they may get off the ventilator and go home, they get aggressive treatment. And yes, some of them develop very minimal fibrosis. Majority people will get better. So it depends. If you have a high index of suspicion, if a general practice has a high index of suspicion, it's appropriate to get a chest X-ray. And from a chest X-ray, if there is evidence of fibrosis, it's important that you seek help by getting a CT chest or seek help from a pulmonologist within the hospital setting. And we are seeing some of the patients come through from general practice who never presented originally in a hospital setting.
Joe, I'm not saying the majority of my patients, but I am saying there's enough of them coming through our surgeries to make me slightly concerned. And actually, I think it just emphasizes to me every day that if vaccination can lessen the illness, can prevent this from spreading, then I think hopefully our general population will be better for it. But we also need to remember that vaccination is only just one part of our fight against it. A virus has to spread from one person to the next person, and unfortunately, if we don't, socially distance ourselves, we don't wash our hands, and actually we don't adhere to those rules, which sometimes I think we're getting tired of those rules, and there's some rule fatigue going on. We're all very bored of being in our house and talking to our families and not being able to see our friends and go out to restaurants or go out to pubs or go out to the cafes, or to stand on a street corner and talk to our friends, because actually, all of those things unfortunately can pass the virus on. And if we, in countries where they've really nailed this, like New Zealand, they have absolutely, adhered to the rules, and the virus can't jump. If it can't get from one person to another, we will stop it. So we have to remember the vaccination is really important, but we just need to carry on, however tired we are of it, with this social distancing thing.
Thank you, Dr. Kerfert. Julie, we're coming to you. So Julie, you've heard the discussions so far. What are your thoughts? How can we get the messages out there about the seriousness of this disease and the importance of protecting ourselves?
I think having events like this, but also just having conversations within our own households, with our family members, with our work colleagues, understanding and learning from each other actually as to how each of us are feeling. We're all in this together, and it feels like a very long journey. It's been going on for a very long time, and as other people said, the death toll, everybody I'm sure on this webinar has had some experience of loss or severe illness from family members, friends, and so I think the key thing is to keep the conversations happening, and also importantly, look at the information you're receiving. I use social media like most people, and some of it really warms my heart. I think this is really accurate, it's well researched, there's a lot of the evidence makes good sense. And then there's other information that I see and I just think that actually I can't understand that. So I'm then looking at the source. Where has that information come from? And so information does give us power, and it's really important, but it's important that we look at where that information has come from. And if we're not sure, there are some really good information sources that we have within the UK. The NHS has an incredibly good website. There's Bristol City Council also has lots of information available. Our communities leaders, we're working really closely with them to support them, develop Q&As for people so that if people have concerns, they know where to go to get some answers. And I think the other thing is in having those conversations, it's also really important not to be judgmental. We are all individuals. We all have our own bodies and our own choices to make. And so getting into an argument with somebody actually doesn't help. It's more about just keeping that discussion and that opportunity for people to think over, take some time. It's not a snap decision. You don't have to make it tonight. You don't have to change your viewpoint tonight, but you may over a few days actually think about something, do a bit more research, do a bit more fact finding, and then come to your own decision.
Thank you for that, Julian. You know, you're talking about the importance of research. What about materials and resources in other languages?
Yeah, in Bristol, we have got some of those already available. We're also always looking to develop more, and we really value some input from our communities. And like I say, we have got some community leaders. I know Mohammed is incredibly involved in parts of Bristol, as are others. And we're always seeking to better understand from our local community, how can we help you to develop your understanding of particular aspects, and that may be about COVID, it might be about all sorts of other things. There is more to life than COVID, I keep telling myself that. So it's about just working with us, telling us what is it you need, and then we can look to how can we resource that and produce things with our community. It's not about us doing, it's about us together working to ensure that all of our community is involved and fully informed.
And who do people contact, Julie?
So Mohammed, I don't know whether or not it will be helpful for you to come in here, because you're fully immersed in our local community in that respect and have
and I just really echo what you said, Julie, about the community champion this. So we've got really key community leaders who are really they're taking the initiative as well, which is that really key. Is coming from community, and they're really recording messages and sending messages now to their communities to encourage people to take up the vaccine. So I really want to say that we have a fantastic asset in our city, within our communities, and people who are really passionate and who want to save life. So they are really, we got the information from Public Health England, we got the guideline in different languages, which is really can be shared. But also we have key people who start really recording messages, about their own experience, going through COVID, but also encouraging people and also this, talking about some of the myth and the challenge which, face different communities. So we have fantastic local resources, which I'm sure, Dr. Joe, we can share with any information going out to participants, all the link into the posters and videos in different languages, but also link into social medias where we know, for me, is what the success of the work we did around COVID-19 and reducing the number in some part of the city, in any city, is the messenger, getting the right messenger to get the message. So the message and the messenger. And we have a fantastic messengers in the city who can really get that message out.
Thanks very much, Julie. Thanks very much, Mohammed. Dr. Murphy, we're coming to you. What are your thoughts about how people who may not be registered with a GP, how can they get a COVID vaccine if they so wish?
Hi there. I'm not sure there's a system for that at the moment. Maybe some of the GPs who are more involved will know that. I mean, my advice would be what I'd like to emphasise is that everybody who lives in Bristol and the rest of the UK is entitled to register with a GP. Some people have understandable concerns about that if they are involved in immigration uncertainty, but that is irrelevant to registering with a GP. So everybody can register with a GP, and you can access vaccinations free for everybody, and all COVID testing and COVID care is free for everybody. It's a complicated system because some people are charged, some people who visit this country are charged for secondary care, that's hospital care, but all care for COVID-related illness is free to anybody with any immigration status. So I would advise you, if either you or you know anybody who doesn't have a GP, encourage them to register with a GP. I can include in some of the information that goes out later, information about that and information in different languages about that. So make use of what is universal healthcare in the community with a GP, and you will have access to vaccinations that way.
Thank you. Dr. Kerfoot, anything to add? Thank you, Dr. Murphy.
Yes, I think the central organisation cell that I sit on is been working over the last 2 weeks to try to say, how can we reach hard to reach groups? So people who don't have their GP. Currently, we have to input the vaccination into a system, which then lets your GP know that you've had the vaccination. So if you get the vaccination at the mass centre, your GP practice will know. But if you don't have a GP practice, it's quite difficult to do that. So we have a homeless population. We have a we have a population who aren't registered with GPs. We have a travelling population that are quite transient as well. And I think we need to make certain quite a lot of these people are more vulnerable citizens, and therefore we do need to work out a way. And currently the cell is talking about pop-up clinics going down into, if you won't come to us, we'll come to you approach. And that will hopefully be developed and finalised over the next few weeks, and then we'll be out. And when we were working with the Pfizer vaccine, which, as Charlie said earlier, was quite difficult to move, it's quite fragile. Now we've got the Oxford AstraZeneca vaccine. I've certainly been out and about doing the housebound in my area over the last couple of weeks, and found that actually it does move around quite easily, and we're beginning to do that. So let's hope that the system is sensible, and actually how people will find out about these pop-ups, I don't know. We need to sit down and work with our local councillors, your local team, and our community support, and all our faith leaders, to make certain that we can once we've worked out how we do it, we need to get it out there so people know where to go to get the vaccine. We want to make it as easy as possible, not as difficult as possible.
So the vaccine should be available to everyone, and it should be free. Is that right?
It will always be free. If anyone tries to charge you for it, refuse it. Try to take their name, take a photograph of them, and contact contact the police. I mean, it's there's a scam out there at the moment with people wanting money, and I think no one will ever ask you for your bank details. No, if anyone ever does, then please just don't give this. That they are not part of the NHS. This is free.
Thank you. Now, everyone, I'm mindful of the time. There are a couple more questions we want to answer. So we're going back to the GPs. GPs, we need clarity on breastfeeding and pregnancy with respect to the COVID vaccine. We've answered it earlier, but people are still not sure. Can you go through it again for us, please?
Neil, did you want me to come in first, and then? Yes,
please, Charlie.
Yeah, it's a really pertinent one. I've tried to answer some people's questions in the text too, so have a look in the answers there, because I put some of the rationale for that. So the situation is that because we haven't done the clinical trials yet for pregnant or breastfeeding women with the vaccine, the UK government took the decision not to immediately advise to have it because of that uncertainty. We didn't want to I think the government didn't want to push people too hard or too fast. Having looked at what other countries are doing, so America's taken the other approach. So in the US, they've actually said they've leaned more towards giving it, and that's because they couldn't see any good reason to be really fearful of it. And it's worth pointing out that we give other vaccines for pregnant and breastfeeding women. So we give flu vaccine, we give whooping cough vaccine. Those are strongly recommended for pregnant women. So it's one of those situations where we wanted to take it carefully, look at the evidence as it emerged, and that's why the advice now has changed to kind of risk assessment. So if you're somebody with a medical condition, or you're at particularly high risk of contracting it, so I'm not going to give too much away here by saying my wife's a frontline healthcare worker. We've got one child who's about 3, so it's something that's on our minds. And so it's something we debated, and because of that risk of contracting it, she decided to have it. Now that might not be the same decision for every woman, but it's completely within every woman's choice to have it if they're offered it. And I mean, finally, just to point out that most women currently won't be offered it because they'll be below the age of 50, and most pregnant women don't have a chronic medical condition, a long-term medical condition. happy to take any follow-up or
Yeah, I
from
mean,
you.
just to pick up on Joy, I think the Royal College of Obstetricians, the Royal College of Midwives have published something on the 12th of January, which is a statement which basically says that if you're not a health and social care worker and do not have a list of medical conditions, which include kind of organ transplantation, currently being treated for cancer, having a bone marrow issue or a chronic lung condition like cystic fibrosis or severe asthma or immune deficiency, or if you have Down syndrome, or if you have conditions affecting your spleen, including having your spleen removed, or significant kidney or heart issues, then the recommendation currently is that you should wait until your pregnancy is finished to have the vaccination. But what you need, I think, is to speak with your midwife or your obstetric team, or speak with your GP, or look online and try to kind of go to some reputable website like the Royal College of Obstetricians and Gynecologists. And I'll certainly share this article with Jo, so she can perhaps attach this to any information she sends out afterwards. But the advice is that it's safe, but actually currently it is given to you after a risk assessment and a conversation. And some doctors, nurses, healthcare workers will go ahead and get it, and others will choose not to. And I think we have to respect both decisions.
Thank you, Dr. Kerfoot. Everyone, I'm mindful of the time. We have 5 more minutes, and I want to use this time just to go back to our panelists to give us a last word. Panelists, there's still so many unanswered questions. So if there's anything that you've seen that you think is worth highlighting, please do that. So Dr. Murphy, we'll start with you. Your last word.
My last word is I hope this meeting has been helpful for people and has clarified some of the uncertainties. And I hope you feel able to go ahead with the vaccine when it's offered to you, having listened to this information and looked through the information we'll send on after this meeting.
Thank you, Dr. Murphy. Mohammed, your last word.
Life is a gift, and God really granted us precious life. So we really need to take all the steps to protect, and our responsibility ensure that we really appreciate this gift by taking the step to protect ourselves and protect our loved one. And one last thing is, an institution is us, all of us, and we need to trust the institutions and work with them. Thank you.
Thank you, Mohammed. Life is a gift. Dr. Kenward, your last word.
One of the best moments of the last year for me was a few weeks ago. I'd had my COVID vaccine the night before, and I was doing a vaccine clinic the next morning. And I vaccinated a lady who'd come in. She turned 100 at the weekend on the Sunday, same day as my 3-year-old daughter. And when I stuck the needle in her arm, she showed me a picture of her sitting with her card from the Queen. And it was just one of the best moments ever. I'll never forget it. So if she can do it, we can all do it.
Thank you, Charlie. Thank you. Julie, your last word.
My last word is thank you. Thank you for every single person that has turned up this evening to join us for this webinar. Thank you for those people that have already had information to have those conversations with their loved ones, those ones that are most vulnerable to severe illness from COVID at this time. And my other bit that I just want to add is we have the vaccine. It is getting more and more available, which is superb and excellent for all of us. But in the interim, we have to continue with hands, face and space for a little bit longer. Thank you.
Thank you, Julie. Dr. Adamali, your last word.
I'm going to leave on a happy note, Jo, and I wanted to share just 2 minutes of a story of a gentleman that I met before he was being ventilated. He was a Somali gentleman who had 5 children, and he had COVID-19. He spent 50 days in intensive care unit. He recovered. He did amazingly well. But the best bit of the whole story is that a few weeks ago, we set up a flu vaccination, and he turned up for the flu vaccination with his whole family to thank us for the amazing work we had done on him. So I want to leave on a positive note. People can recover from this illness. You can protect yourselves with the COVID-19 vaccination, and you will live, love, and enjoy life to the fullest. We're in it together. Let's get out of it together. Thank you.
Thank you very much, Dr. Adam Ali. Thank you. Heartwarming story. Dr. Kerfoot, your last word.
Thanks, Joe. I think the population of the UK is 67 million. There's been 100,000 deaths. That's 1 in 670 people. And for me, that's getting a bit too close for comfort. So this vaccine is free. It's available. Millions of people have had it. And we need everyone to come forward to have it so we can get on with our lives, control this, horrible situation we find ourselves in, and move forward. So I would implore you to write down the positives. Why should I have the vaccine? Write down the negatives, and that's about you and your community and your families. And then and really have a good consider and write down the list and look at it, and then share that with your friends and your family and discuss it. And let's have an open and honest discussion about it. And hopefully we'll all come forward and get the vaccine when it's your turn. Thank you very much for having me today.
Thank you very much, Dr. Kerfoot. And last but not least, Dr. Lazarus, your last word.
So we all want to get out of this pandemic. And from where I'm standing at the moment, it seems that vaccination is going to be the way out. So please get informed, don't stop asking questions, and get vaccinated.
Thank you very much. I just want to say thank you this evening to all our panelists. Before I hand back over to Councillor Craig, thank you to everyone who attended. You have submitted so many questions. We could only answer a few, but we will do our best to take those questions, provide an answer. We will be sending you a post-event email with a link from tonight. We'll be answering the questions that we couldn't this evening and sending lots of resources. So please watch this space. Hands, face, space. You control your space, I'll control mine. And together, everyone, let's control COVID. Councillor Craig, over to you.
Thank you so much, Joe. So today we heard that the number of deaths from COVID-19 have exceeded 100,000 here in the UK, the highest number in Europe. And I've also just found out that the number of cases worldwide has now reached 100 million. That's not the kind of statistics that we want to keep on hearing. But sadly, we are going to still see quite a lot more deaths over the next few weeks as the vaccine starts to take effect. We're tired of being in lockdown and not being able to meet our family and friends or go out to a concert or go out for a meal. Vaccines are our ticket back to freedom, and events like this are just one way to communicate with the wider public. The way all of us refer to and discuss COVID-19 vaccine can literally help us win the battle against this devastating virus by tackling misinformation and improving the uptake, which is really crucial. I said at the beginning that we wanted people to leave the event knowing more about the vaccine, which is safe, having as many of your questions answered as possible, and hoping that many of you will go away feeling a little bit more confident to maybe go away and talk to your friends and family about the vaccine. I too would like to thank our speakers and all our panelists, Dr. Rajeka Lazarus, Dr. Neil Kerfoot, Julie Northcote, Dr. Charlie Kenwood, Mohammed El Sharif, Dr. Huzaifa Amjali, and Liz Murphy. And I want to thank you, the audience, for joining us this evening. As you heard from Joe, if you've not had your questions answered, They will be answered, and we will send a link to you so that you can find out the answers to your questions. We will keep posting the right information, and through the work of Bristol City Council and indeed the COVID-19 Race Equality Group, we will continue to push out reliable information so that you can all make an informed decision around the vaccine. So good evening, everyone. Thank you again for joining us. Good night.